Morning on ITV is another discussion segment. Now, with the COVID-19 pandemic, there are many jingles, many items that, of course, gives information on how to prevent coronavirus. One of those, if you are conversant with the different type, one stands out. That one is called flattening the curve. And most time you see him very simple in his long sleeve shirt, with the graph explaining and teaching how the curve can be flattened. Today we have him in the studio. He is a consultant orthopedic surgeon and the Medical Director, Alliance Hospital, Dr. Christopher Otabo. Very good morning and welcome.
Thank you for having me. And I'm happy you didn't stretch forth your hands to shake me.
Okay, we're going to be looking at how the federal government is strategizing to actually get those that are COVID-19 asymptomatic to be tested and, of course, tackle the spread of coronavirus in Nigeria. And Doc, there are very many input from many experts, some medical, some are not medical experts, but everybody is talking on how government can go about, curbing the transmission of COVID-19, especially in community areas. Let's get to hear what are your thoughts on this.
Thank you very much, Joseph, for having me. Good morning, viewers. The COVID-19 pandemic is with us, and it's spreading. I think just about 7 weeks ago or so, we got the first case, and we did everything we could. The government tried to push it at bay. But unfortunately, the effort has not helped to curtail the spread. So what we have now is community spread, because epidemics are in phases. Initially, you have the index case, and afterwards, that index case, like the one that came in from outside the country and a few others that came in through the airports. Afterwards, if you can't curtail it at that point, it now begins to spread to the contact of those, the index case. And if it's not curtailed at that point, it gets into the community. And that's the phase we talk about community spread. In community spread, you can't, someone comes up with the disease and you can't link him or her to anybody because it's already within the community. A few weeks back, if anybody came up with the disease, you could say, oh, he made contact with one person that made contact with someone that came from abroad. But at the stage we're in now, we cannot trace those people. We can't trace the source of the disease, and that's the community spread stage. And that's the most dangerous part, especially with the fact that the majority of the people who have the virus will either have mild symptoms or no symptom at all. That means that people that we meet every day, we interact with, do business with, even sleep in the same house, may have the disease without them knowing. Because if they know, they would take precaution about how they go about their daily activities so that they don't infect other people, especially their loved ones. And if they also manifest with symptoms, people will also take precautions to prevent themselves from those guys who have it. So because the disease is silent in many people, and symptoms, if it's going to come up, may come up late, and yet they're able to infect others, This is the problem with the coronavirus. Unlike Ebola, Ebola had a shorter incubation period, and if people had it, it manifests. And so you could say, okay, these guys have it, and we'll avoid them. So right now we are still on the lockdown as one of the measures taken by the government to curtail the community spread and for them to be able to trace those who have the virus, the disease, and isolate and treat. But unfortunately, on the other end is the consequences of the lockdown, which we cannot shy away from. People are suffering, people are hungry, and a lot of people are dying. They are not dying directly from the virus, but they are dying as a consequence of the virus.
Like those on emergencies.
Yes.
Women in labor.
Thank you. Hospitals are so skeptical now. Cases that normally doctors will embrace and quickly treat and save lives, people are shying away. And so there are needless deaths happening all over the place. And this is one of the consequences of a pandemic like this. If you listen to me when I talked about flattening the curve, I said that the problem about increase in the numbers is not necessarily because of the severity of the disease. But when you have quite a number of people presenting at the same time with symptoms, those who have minor illness that could have been treated, they would be relegated because the hospital facilities are inundated. And secondly, people are now afraid to treat even normal cases. I heard of a young lady that died of asthma because when she had an attack, rushed to the hospital. Of course, asthmatic patients will come with difficulty with breathing. Yet that's one of the cardinal symptoms of severe coronavirus disease. So doctors were skeptical. They had to go, instead of quickly administering just one shot of a steroid injection would have saved that lady. Everybody was running around trying to get personal protective equipment, because they have to protect themselves. I don't blame them.
Of course, we have had about 3 deaths.
Exactly. Over 100 doctors have died in Italy since the pandemic started, less than 3 months. So you don't blame healthcare workers who try to protect themselves. So before they came back with their PPE, kitted and all that, the lady was gone.
Okay, now let's look at this strategy by the federal government and, of course, the PTF. Most times said those eligible to be tested, even at the community level, are those with symptoms. How far can this solve the situation?
I think the reason for this is because of lack of resources. See, when you don't have enough resources to go around, you want to ration it. You want to bring in inclusion and exclusion criteria, and so on and so forth. So that is a minus for us in the fight against the virus, because one of the most important things we should be doing now is to be testing. And if you have limited resources in terms of the testing facilities and all that, you would want to limit it to people who already have symptoms. People who already have symptoms, they have already identified themselves. What they need is to go to the hospital and confirm that they have it. The real bomb are those people who don't have symptoms. Okay? So let's just look at comparative studies now. Ghana has done, as at 5 days ago, over 70,000 tests. Ghana is a population of about less than 40 million people. They've done over 70,000 tests. Nigeria is a population of
5 times.
Of 200
5 times
million.
Ghana.
Yes. Lagos and Kano alone is more than the population of Ghana. And Nigeria is still talking about just barely over 7,000 tests. So no wonder we are talking about 800 and something cases. Because the more you test, the more positive results you get. And the more you understand the reality of the disease. So we are not testing enough. We need to be testing enough. If and when we get enough testing facilities, we would stop sticking to those who have symptoms, and we would go to the communities to test. Hospitals will have the opportunity to test, and this is where the rapid test comes in. Because what we are doing at the moment is molecular testing, whereby you want to see the virus, the genetic material of the virus, which is the polymerase chain reaction, PCR. Okay, that is actually confirmatory because you see this gene sequence. But the rapid test, though the accuracy is not very high, but it will help a lot as a preliminary screening, and that can be obtained. That service can be available in almost any hospital, because it's just like HIV testing now. You can walk into any hospital and say, I want to do HIV testing. All they need is take your sample and put it somewhere in the device, and within 2 minutes the result is out. Yes. So, but even that HIV test that we do in many places is not confirmatory. But more than 90% of the time it is accurate, or maybe about 95%. So when you have gotten that result, you take it for a confirmatory test. That's where the molecular testing is done for HIV. So it's a polymerase chain reaction. That's the final test. But just imagine that we were waiting to do PCR for every HIV test, we will not make the kind of progress we have made.
True.
Yes, despite the fact that there are weaknesses, but I think that we should allow rapid tests to come in, whereby almost every hospital, whether private or government, will have the facility. And all you need is just a drop of blood, and because you are testing the antibodies now, not testing for the antibody. When the virus comes into the body, it stimulates the body to produce antibodies against the virus. So it's an indirect test. If the antibody is present, then you know that there is virus somewhere. You can now send them for confirmatory test. Yes. So if we have the testing facilities all around, when people come into the hospital, you quickly do that test. If it is negative, then they can come in, and you don't have any worry now to treat them. False negative is not as high. What I'm trying to communicate is, when you do that test, it can be positive when the individual is actually negative. So that means it's false positive. No problem. Not much problem about that. All we need is now to go for a confirmatory test, which will free the person. Okay.
Whether,
yes. But it can, yes,
or invalidate.
Exactly. But it can hardly be negative when the person is positive. I don't know if you get my point. Yes.
I get it.
So it's a good way of protecting the healthcare workers. So if everybody who comes into the hospital for any reason is mandated to do the test before you come in, so the healthcare space is secured. So if it is positive, please go clear yourself. And then if the molecular test shows negative, then you can come back and see us. But if it's still positive, they treat you there, they isolate you and treat you there. So in that way, the hospitals are safe, because when individuals who are asymptomatic, the hospitals don't know whether they are positive or negative. When they come into the hospital, it will take just one patient who is positive and yet asymptomatic to infect maybe 10 or more hospital staff. And in the process, that's a bomb, because when he leaves, the hospital staff now will infect the other patients that are coming.
And their colleagues.
And then, yes, so it just keeps cascading. So this is why we need to do more tests so we can know where we are.
But in this, you have just advised that more testing is required at this time, and the strategy of saying you test those with the symptoms is really
not going to help. It's not going to help.
Then what about recalling retired medical doctors and nurses? What does it show?
I don't think that's a smart idea. Why? Because it can boomerang. Yes, because when you look at the demographics of the people, the presentation and the severity of the disease, the older people are more vulnerable, and they are likely to die from the infection than the younger people. So if you go bring back people who are retired, you might have a big problem in your hands months down the line, because many of them can get infected, and they are going to add to the disease burden. If anything, there are a lot of young people out of school looking for jobs. There are a lot of doctors, nurses who are just at home. That's the pool from which we will get manpower should we need people to take care of the patients, not the retired ones. I think the retired ones should be behind.
Remain where they
are. Should be at home, locked in. Yeah, because they are more vulnerable. Yeah, so because grandchildren are known to pass on the disease to grandparents. Why the grandchildren are fine? Because of their immune status. And then the grandparents are dead. I mean, this is studies from the other parts of the world. So I don't think that the retired medical staff should be brought in. I think that if the government wants to beef up their manpower for health, just one advert, there are so many young people who are waiting
qualified.
Yes. In some other countries, the final year medical students who are waiting to graduate, maybe 6 months to graduate, they recruited them as doctors to come and help the fight instead of going for the older ones.
Okay. If I just joined us, the program is This Morning on ITV, and we're looking at federal government strategy to actually tackle COVID-19 from the asymptomatic patient. And our guest is Dr. Christopher Tabo, the medical doctor of Alliance Hospitals, also a consultant orthopedic surgeon. Now, let's look at the private sector, where the PTF yesterday says you cannot treat COVID-19 patient without approval. At this time that you do not know who is who, like you have said, there are still issues of malaria, typhoid, asthma. People still come for different kinds of hospital services. You cannot say, as it stands, you stay there, let us get to find out if you are a patient of COVID-19 or not. And the federal government is saying you cannot treat. How can this be balanced?
Well, the truth is that many private hospitals are already treating COVID-19 patients without knowing it. Well, they are not treating them as COVID-19 patients. They are treating them for whatever it is that brought them to the hospital. But eventually, they will find out that they were treating COVID-19 patients. And that is the danger. And many hospitals have closed down because of that. And that takes us back to the issue of testing. Because it's not until you test, you will not know who is who. I agree completely with the government that private hospitals should not intentionally treat COVID-19 patients, those that have been found to be positive, without going through approval process, because that will lead to abuse, and the staff of those private hospitals are at risk. Because for any center to be accredited to treat COVID-19 patients, there are procedures, there are trainings that take place, there are preparations, there are protective equipments that will be either provided by the hospital or the government will come to. There will be an assessment of the facility to know whether it is even ideal, the ventilation, the movement pattern, and for some, if you want to go COVID-19 where you may have to stop seeing other patients. So we know that you are dedicated to COVID-19. So there are many things that must be considered before the government can say, you know what, we think you are fit to treat COVID-19 patients, go ahead and treat. And in fact, this is the future really. If the disease burden increases beyond this point, governments would be appealing, mark my word, they will beg private hospitals to come into the fight. And the big private hospitals would not have any choice but to come in. Yes. So it's not like we versus them. It's not like government versus private hospitals fighting over who would treat these patients. No. It's about coordination. It's about planning. It's about strategy. So, because if we have 3 times the number of cases that we have now, the government hospitals, their facilities would be overwhelmed. And don't forget that on a good day, private hospitals treat between 60 to 70% of all patients in Nigeria. So you can't, that size of service providers cannot be ignored in the face of a massive crisis like this. So what is important is that private hospitals should pass through the process and get the appropriate accreditation. And in fact, government should support with the personal protective equipment and other things that are required. Yeah.
Okay, Doc, let's go to Kano State, where there are, cases of mass deaths amidst COVID-19. What are your thoughts?
Well, I was in Kano for 11 years. So to a very large extent, and if you practice medicine in Kano for that long, you will have some understanding of the dynamics, in Kano. Nobody can say whether those deaths are from COVID-19 or not until an autopsy is done. But there are conjectures. First, Kano is thickly populated. With the lockdown, there will be health consequences. People will not be able to get the health care that they need at the right time. That can lead to increased mortality. 2, the season that we are in now is a time where mosquitoes have increased in terms of their breeding and their activity. So I expect that there will be a lot of mosquito bites, and that can lead to malaria, increase in the incidence of malaria, which, if not treated on time, can lead to increased mortality. The hunger that the lockdown has brought. You see, the Kano people, a lot of them, they is from hand to mouth. Not just Kano, most parts of the country, but Kano is because of the population. So you have more people who are vulnerable. So if that, if the city is locked down, and maybe people survive through begging, they don't have people to beg because the place is locked down. And then so many will go hungry and just die, So those are some of the postulations. And then again, because of the lockdown, when one person is taken to the cemetery, it becomes obvious to everybody. But if there is the normal hustling and bustling, people will not take notice. They won't take note that there's a body going there because everybody is going about their businesses. So for you to say there is a surge in the number of deaths, we want to find out what is the statistics of government on a good day. See, this brings us back to the planning. It brings us back to organization. We cannot continue to run our country this way, where we don't know how many we are. We don't know how many new people are being born into the country. We don't know how many are dying. If the government of Kano State was, keeping tabs of, they are keeping abreast. Yes. Well, they needed to come up, to say, look, the death rates in Kano is, let's say, 100 per day, and now we are having 100. So there's nothing. It's normal, but they don't have it. People die, and they are buried. Nobody is checking the numbers. People are born at home. They are adding to the population. Nobody is checking the numbers. And now you want to start crying foul that people are being buried. People are normally buried. In Kano State, the death rate in Kano is high. That's the truth. So, but we cannot rule out the fact that we might just be dealing with COVID-19. That cannot be ruled out. But the truth of the matter is that nobody can say for sure what. So I'm happy that there's an investigation that is going on. Even if the people died of COVID-19, even after burial, if they are exhumed, the diagnosis can still be made posthumously. Yes, so, but that does not take anything away from the fact that Kano is in a mess right now. When the pandemic started in Lagos, I had one prayer. I said, God, let it not get to Kano. But unfortunately, it's in Kano. Kano that I know, apart from the population density, the way of life of Kano, their social interaction is so closely knit that the rate of spread will be higher in Kano than almost any other part of Africa.
And, with what medical experts have said, in a country, if, say, 99 states are free and you have one state that is not free, it means there's still danger.
Yes, sure.
So what can the federal government do now? Kano is already a hotspot.
Well, I like the way the federal government joined forces with Lagos State when this issue first broke out in Lagos. I remember the federal government, the president approving 10 billion naira to fight the pandemic in Lagos. I think a similar thing should be done in Kano. If I were the NCDC boss, my office will relocate to Kano. Yes.
Why?
Yeah, because because that is the greatest danger. Kano is the greatest danger not only to Nigeria but to Africa. Yes. Kano is located along the Trans-Sahara trade route. And it's a commercial center and is a melting pot for the North. And you cannot keep people locked down forever. And very soon, people will have to continue with their lives. Because one thing we learned very early in our medical school days is that when you are proffering treatment for any disease condition, the treatment cannot be worse than the disease that you are trying to cure. So if you are going to have 500 people dying per day from hunger and deprivation against 50 people dying per day from the virus, then you have to review your strategy. Yes. So eventually people will be allowed to move. And when the movement continues,
even if
whether we curtail the virus or not, eventually people will have to move. Yes.
Yeah, but that poses great danger.
You see, it's like between the rock and the hard place, or between the devil and the deep blue sea. So that's why people said that in the week ahead, the president is faced with a tough decision. I agree with that. So if you refuse to remove the lockdown, when people reach their breaking point, they will come out. It doesn't matter the number of policemen or soldiers you have on the street. They will have to come out. So whatever decision needs to be made has to be made with a lot of intelligence, a lot of consideration. So if people start moving, before you know it, from Kano, this thing can spread to countries, not just within Nigeria. So Kano is like sitting on a keg of gunpowder. The federal government should focus on Kano and see what can be done to quickly control that place. If not, what happened in Italy or Spain might just repeat itself here in Nigeria.
We just hope we don't go that way. Okay, before we go, Doc, let's get your opinion regarding the composition of the PTF. There is no representative of the private sector. What do you say about it?
Well, it's the president's call to choose those that he deemed fit to deliver on any assignment. But at another station, I think one of your sister stations, I have already mentioned it. It's not just the private sector. The president of the Nigerian Medical Association, who is leading over 30,000 doctors on the front line of this battle, should have been represented in that presidential task force. Because the NMA president is like the numero uno, is first among equals of all the doctors in Nigeria. So I think that should have been there. And if him not being there, the consequences are already showing. When the Chinese doctors were going to come and they were going to bring things, something that should have been celebrated, because I had inside information about how the things were going to come in and all that. Very good idea from the beginning, thanks to ECC. It was purely a private arrangement, a CSRO to help the fight. And also because the Chinese are also here, they also need protection. But the NMA, because they didn't have that information or the appropriate information, they brought out a press release, condemning what the government was doing, and it appeared as though the government was the one inviting them. So if the NMA president was in that committee, it would have been easy for them to interact and they understand themselves. And many other things. I don't think it's too late, because if we look at, if we understand the trajectory of the disease, we are just still in the early stages of the disease, of the fight. So I don't think it's late for the NMA president to be co-opted into the committee, and also the private sector. We have the Guild of Medical Directors. We have the AGPMPN. These are people who represent hundreds and thousands of private hospitals. Those two people should be in the committee, because when push comes to shove, you would need them. And if they are not there, it can lead to discordant voices, which will not help the fight at the end of the day.
Okay, I'm tempted to ask just one more question, and that is coming from WHO. They actually predicted that Africa will be the epicenter of COVID-19 in the coming days.
Well, I have my reservations about WHO. Personally, I think that they've not done well in the way they have handled this pandemic. Initially, WHO came out to say there's no evidence of human-to-human transmission. They came out to say China is handling this pandemic very well, oh, thanks to China. But everything have shown that they were wrong. And so I think WHO should just leave us to fight our fight. If they can't help us, they should not complicate it.
Okay, I must thank you for coming on the show. Okay, but did you see how a say as far
yes, they can advise. They can advise, but we are not obligated to take their advice hook, line, and sinker. As a country, let's also develop our own homegrown solution to our peculiar problem. And I take exception to that, the fact that, oh, Africa is going to be the new epicenter. That is possible, and at the same time, it may not happen, depending on how we tackle it at the level of the political class and also the medical community, and even the behavior of the people. Yeah.
Okay, thank you very much for coming on the show.
Thank you.
Okay, that's the much we have on this discussion segment, and it has been with a consultant orthopedic surgeon, the medical director, Alliance Hospital, Dr. Christopher Otabo. We'll now take a quick break. When we come back, the program This Morning on ITV will continue. Stay.